All right, so I think we're going live or we are live. It's loading. All right, so now you can see it's live. Can you guys see that it's live on your screen?
Yep.
All right. So I'll start. Hey, everybody, thank you for tuning in. If you are tuning in to our series, I'm Black with a Therapist series. I'm Krystal Fortney. I'm the founder and therapist of Eating the Mind Counseling Consulting Services. And I have two wonderful people joining me on this call today or this webinar today to discuss medication, mental health medication in the Black community. They're going to give their perspective from prescribing medication to being a consumer of medication, and I'm just here to facilitate the questions. So if you do have any questions, please drop them in the comments below. We are going to be able to answer those questions here. If it is personal questions like, should I take this or should I not take this, that is something that we won't be able to answer on the live. But if you hit my inbox up, I can definitely connect you with Tori, which is our prescriber, and he can set something up with you. If you have more questions of just the experience and you want to know it from a personal level, you can hit me up. I'll give you contact information from D'Angelo. Of course, if you want counseling sessions, hit me up. If you are my friend or relative, I'm not counseling you, hit me up. I can refer you out. But I ain't counseling you, though. I know too much about you. But anything else, like if you just don't know something, feel free to hit me up and I'll direct you in the right place. Also, I just want to make a disclaimer is that D'Angelo is neither of our clients. So I want to make that clear. We don't have a consumer here. I'm not providing counseling to him. Tori is not prescribing medication to him. It's just purely from his perspective, his prescriber that he will not disclose their name because we want to protect their privacy. But anything else you're just curious about, drop it down below or send it to my inbox and then we'll go from there. This is going to be a real generic, real just open conversation, discussion, nothing scripted. So I'm going to start by letting Tori introduce himself and then tell you a little bit about himself, and then D'Angelo will go after it.
All right. Hello, my name is Tori Woodard, psychiatric nurse practitioner. Went to school, undergrad TSU, grad school MTSU in clinical psychology, worked as a therapist for some years, and then decided to kind of step into the medication stance of things, really seeing how African Americans were responding to the doctors that I was kind of working with, kind of made me feel that a face that looked familiar was needed. So that kind of prompted me to get into the field of nursing, psychiatric nursing to be exact. So became a nurse practitioner in psychiatry and I've been practicing as a prescriber now for over a decade. So that's it.
Thank you, Tori. D'Angelo.
Hi, everyone. My name is D'Angelo Sears. I am a native of Memphis. I am a graduate of University of Memphis with a degree in professional studies, concentration in health administration. I do currently work for AutoZone as an immigration specialist. Although not a clinician, I have been dealing with mental health since 2010, so I have had my own journey. And very happy to share it with everyone tonight. So let's have a little fun.
All right. Thank you, D'Angelo. So we're going to jump into my first question. You can just speak whenever you want to. So the first question, this is for both of you guys. What is the biggest misconception about psychiatric medication in the Black community? What is the thing that you hear all the time that's passed from our grandparents to our cousins to our parents? What is that misconception that you hear a lot?
Okay.
The most common would definitely. Sorry, Tori, go ahead, please.
No, I was gonna actually tell you just go ahead first. Actually, so go ahead.
Okay. The response that I typically get a lot, because I am very open about my mental health journey, is what's wrong with you? Are you crazy? Are you dangerous on certain type of medications? You would be very, very surprised of the responses that you get. It's almost people become afraid more so than concerned. So for me, that's a very common misconception or stance that I get.
I like that phrase you said that like most of the time people are more what did you say? Something besides concern. I like that. They're more afraid than concerned. Yeah, I like that. Tori, what about you?
Kind of same things. Taking medicine, being on psych meds in the African American community, Black community, you're going to be looked at as crazy. Not so much now as it was, say, even a decade ago or when I was growing up. I mean, it was really taboo years ago. A little bit better now, but still, that's usually the last thing that our community is thinking about. We have so many other things that we're doing to self-medicate, I would say. We'll probably end up talking about that later on tonight. But medication is usually a no-go, often on the front end, at least when it comes to mental health, because people think things like I'm crazy, or I'm not man enough, or I'm not woman enough, I'm a failure. So a lot of things, and spirituality, of course, plays a part in it in the African American community. So a lot of times it's like God can bring me through this. I can be healed and don't need the medication. So a lot of different factors, but it is challenging, and I don't blame anybody for having those challenges, because I would have the challenges myself. But you got to talk about it like we're doing tonight.
Yeah, I think I was going to piggyback off that, especially with like Christianity. It's a big thing of like being raised in the church, and my mom is a minister, and a lot of my friends' parents are pastors and things like that. Which most of my friends that are parents of pastors, they're very open to mental health, but some other churches are not so much that open to mental health. I hear things like, once again, like you should pray about it or you're weak. I do a lot of teaching mental health first aid for churches. And that's one of the things they say, like, I don't understand it. Maybe you should just pull yourself up by your bootstraps and, go through it like everybody else. Why do you need medication? Has it gotten that bad? Like, it's almost like a sign of weakness to say like, hey, I need some extra assistance with medication. So I think that in our, Black population, it can be a sign of weakness. It's like you're not strong, when really deciding that you do need medication and therapy is a very strong thing. But in our community, people don't necessarily look at it in that way. So I agree. D'Angelo, this one is for you. What was your experience like on medication, positive and negative? So tell us about like how you got to the place where it was like, okay, I might need some additional help. Did your therapist refer you to someone? Like, how was that experience of, one, deciding that it was time to go that route, and then two, what was your experience like, positive and negative?
Okay, great. Thank you for that. So, great segue from what you just stated. I was actually diagnosed with dysthymia, depression, and anxiety in 2008. When I first heard those words, I ran, because all of my life, that's what I heard. You take it to God, He'll make everything all right. You just need to get some rest. What are you stressed out about? You too young to have these type of problems, things of that nature. So when I was diagnosed, I ran from it for about a year. Maybe a few months within that year, things got really bad for me. It was very difficult to get up in the morning, to walk from my room to my bathroom, which was probably about 15 steps. Felt as though I had about 300 pounds of weight on me. I would sporadically break out in really bad crying spells. I would shake really bad, night terrors. It was a deluge of things, to the point where my family was like, okay, now it's time to get help. Within that moment, I was in school at University of Memphis, and a fraternity brother told me that the school provided free psychological counseling, and that it was something that I should look into. So I did, and that started my journey as it relates to therapy. From there, my therapist did recommend that I see a psychiatrist, whom of which was employed through the school. And that started my journey as it relates to medicine. I can't say that I had the greatest experience specifically with antidepressants. The actual doctor himself, he was very great with facilitating, understanding, explaining. because it was very new for me and I was extremely scared. I was actually more afraid of the medication than I was of the actual cognitive behavioral therapy aspect of it. But he was very, very helpful, very warming, very comforting. So unfortunately, I don't remember the particular drug because it was so long ago, but I just remember the side effects really taking over first. I remember not being able to, I guess, reap the benefits of the medication. But unfortunately, I was very susceptible to the side effects. And I mean, they included anything from not being able to sleep, to being too sleepy, hot flashes. I mean, the list goes on, and we'll definitely talk more about it, to the point where it also provided a continuum for me to, I think I've tried at least 7 different antidepressants on this journey. And it was an unfortunate battle, but things are a lot better now. So just as a quick summary for that.
Ooh. So Tori, that goes back to you as a prescriber. Like, what do you do when someone does come to you and they say, like, hey, this medication is like having some awful side effects? And I just being a therapist and working with patients, I've heard that too. We'll go to the prescriber and the prescriber is like, well, we need to give him more time. And they're like, I feel awful. Like, if you don't give me something else or take me off, I'm not taking medication at all. Or sometimes the experience, because I do work with people who experience psychosis, their medication side effects are really, really hard. And so sometimes they have those hard side effects and they're like, I'm not doing this. I'm not taking any more medication. I'm not open to it. So we spend 3 months trying to get them to just take something to balance them out. So how do you, what is your approach to that when someone has had like a negative experience with medication in the past?
Okay. One of the things, and it sounds similar to what D'Angelo was talking about, how his psychiatrist was really good at explaining what about the medicines. That's one of the first things that you need to do. Anytime you're prescribing a medication, if a person has had bad experiences with other medicines in the past, or they're naive to medication, first of all, just explaining like the possible side effects. I find that if I can tell you what may happen, then you tolerate it better because you're like, okay, he said my stomach might bother me for a week or 2. Then you're not freaking out. So just being upfront, telling people, hey, this is possibly going to happen, or it could happen. It's likely to. But then at the same time, I also listen to the clients and say, if you're having an issue, tell me, because it's not about I'm getting a cut from the drug company for having you a certain medicine or whatever. It's about you. So if I'm giving you a medication, I am doing it for a reason. I'm doing it for a purpose. You've told me something. I'm listening to your symptom profile. There's something that has transpired in our meeting that says, I think this is the medication that I'm going to choose. So I'm going to find out things like not only what you tried in the past, I'm going to find out things about like, has anybody in your family also taken medications? I'm going to ask questions like, are you drinking, using substances, drugs, smoking, cigarettes, or weed, whatever it may be, because all of these things do play a part in how your body is going to metabolize medications. African Americans, just in general, us being in the South, what we eat typically day to day is going to even affect the way your medications are metabolized. So it's not that I don't believe people when they say, hey, this is making me do X, Y, and Z. Sometimes it's just anxiety of starting something new. Sometimes it's just poor communication because no one had told them before. So being upfront, letting them know what could possibly happen. The client is right 99% of the time. I try to go with that unless a client gives me reason to not believe them. It's not like that doesn't happen either. I'm pretty sure you come across those clients, but but not everybody is lying. So I've worked with some people who they think first that this person's lying to me, and I think that's a poor clinician when you go in already thinking negatively about your client. So that's really, I just try to be upfront, tell them what could happen.
I Too, the approach that I've seen a lot that I feel like works a lot for clients is that I've worked with prescribers who they, like Tori said, one tells you the side effects and stuff up front, but they also give you options. It's not like this thing of like you have to take this medication or you're not, like you have to take this. And I feel like sometimes when people go to prescribers, they feel like you have to leave with a prescription. Like the thing is, you may not leave with a prescription, or this prescriber may say, let me give you time to think this over, and you can reschedule another appointment. But it's not like this thing where from the prescribers that I've worked with, there were great prescribers that you had to leave with anything, because like he said, I think some people think drug companies do drop off their meds. Let's be clear, they drop off samples all the time, right? They are trying to solicit you prescribing their medication. But other than that, you don't really get anything free, but maybe a free lunch.
Maybe.
I mean, maybe a free lunch when the drug reps are bringing something, but that's it. So the prescribers don't get anything out of prescribing you a certain medication. It's like they're not bound by that. Now, I can say, and this is not in a racist fashion or anything, but I have worked with some white prescribers who just, they have a certain medication that they like. It just depends on what, if they're old school. I've seen prescribers literally prescribe medication that they know is not working for this client, but because it's worked for 100 of their other clients, they feel like that's their go-to medication and this has got to work for you. And I've seen that as well. So when it comes to being in the field, like Tori said, like he got into this position because he has seen what it's like being in the field. It's the same as me working with various prescribers. All prescribers are not equal. So
they are definitely not.
Open conversation, because finding the right prescriber is really important. Tori, I have a question from Facebook, and it says, with antidepressants, are they long-term, or is there an option to wean yourself off of it? Is it a plan to get off of it? Should I do this with a prescriber? Should I try to do this on my own? Talk a little bit about that.
All right, most definitely. That's a good question. You should never do it on your own. Never do it on your own.
Never.
Yeah. If you are on medication and it's working, so there are different answers to that question. If you're taking medication, an antidepressant, and it is working, and first of all, you got to say, okay, it's working. Why do I want to come off of it? Because a lot of times people say, well, man, I'm doing great now, I don't need it. You're doing great because you're taking the medication. So I'm just throwing that out there. Can you ever get off of it and still do well? Yes, you can. My rule of thumb is, if a person has basically made it through life for a considerable amount of time, say you're a professional or you've made it through college, you've had a lot of issues, ups and downs, and you handled them well. But all of a sudden, maybe like in your 20s, you needed an antidepressant. They put you on an antidepressant, you got through your rough spot, maybe you were on it a year. That's kind of like my period of time that I say, be on the medicine a year. If you've been on the medicine a year, but otherwise you had done well in life, I'm okay with trying. But after we try, it's better, like I said, to do it with a prescriber, do it with your doctor, psychiatrist, nurse practitioner, because there are certain antidepressants that if you just stopped on your own without knowing how to stop them, you're going to get worse. Certain medicines you can stop because they're going to like slowly come out of your system. Certain antidepressants you can stop, and within 2 days you're going to withdraw. Most of them within a day you're going to withdraw, which could make you feel like, man, I am worse than I was before. So it's better to do that with your clinician, with your prescriber, to help you come off of it. And then I would say, if you find that, man, I'm struggling more now that I've come off of this medicine, don't feel defeated. I have a lot of people that after we've taken them off, symptoms come back months later down the line and they don't want to go back. They feel like, man, I couldn't do it. I messed up, I failed. So if somebody helps you come off of your antidepressant and you're able to do well, great. But if you find that the symptoms are returning, depression or fatigue, anhedonia, no motivation, if those things are coming back, then get back on the medication. So hopefully that answers your question out there.
I got one more question from the audience. What if my medication leaves me with a flat affect or just feeling no emotions, kind of numb?
Okay.
What does that mean that I kind of need to do, or how do I move forward? Do I need to get off, switch medicine, reduce it?
Yeah. That's where it comes into play, the kind of prescriber you have. Gosh, if I have someone that comes to me and the medicine is like wiping you out, I understand what you're saying. Like, I have no life in me. I'm just living. I'm
Here.
present, but I'm not here. I'm just flat.
The mundane.
So, yeah. So if your medicine is doing that, that's not good. That's not good. So we want to like find a sweet spot. I've got some clients that it's hard to find a sweet spot because it's kind of like this thing where the benefits outweigh the risk.
Gotcha.
And that's not good to hear when you're the client and you're flat. But if you're a danger to yourself or others, I'd rather you be a little flat than commit suicide or something to
Right.
that.
I agree.
Yeah. But if you're not able to enjoy your family, your kids, your loved ones, yeah, the medicine's cutting off a little bit too much. So that's when I would either lower it. You should talk to your prescriber about maybe lowering the dose or maybe switching to a different agent. A lot of times just adjusting the medication can help. Also, I'll put this out there. I don't know if we'll talk about it later on, but everybody metabolizes medications differently. You can start a medication and it worked wonderfully. And this is something to notice, that if your medicine was awesome, and then after so many months, it's not like you're depressed, but now you're just like crazy sluggish, maybe that medicine is building up in your system, and maybe a reduction. Maybe you're a slow metabolizer and it just started to build up. So if genetic testing, psychogenetic testing is available, Tennessee's pretty good if you're on TennCare or government type insurances. Genetic testing is typically free. It's called Psych.
Yes.
Yeah, so you could get that done by your prescriber or ask about it. You could see how you metabolize medicine. So if your medicine's working good, but then all of a sudden it starts to flatten you out, maybe you just need to lower that dose.
I like that you said that, because I think that a lot of people don't know that that exists. And I do want to say that it exists because I worked with a prescriber and she would not prescribe to anybody unless she did gene site testing. Unless your insurance just didn't pay for it, she would not prescribe that. And the reason why, because it saved her a lot of trouble of trying to try you on all these different medications, because it prints out a list of all these psych medications. And like Tori said, it tells you what your body can metabolize well and where it can't metabolize well. It even goes far to say, this is green, good. This is yellow, okay. This is red. You may want to stick away from it. So if you're listening out here and you're taking medication or you're considering getting on medication, asking about if they can give you gene psych testing to kind of take out all of the mystery, because your prescriber can start in the green and then move on. I think that's the awesome thing to start with. D'Angelo, did you have any experience with
let me add one more thing. I'm sorry. Okay. I'm sorry, D'Angelo, and then I'm
no, go ahead.
This is another thing that I mentioned. That person out there, like your medicine's making you flat, and I'm not saying that the medicine's not doing it, because it can, but what other things are you putting in your body? Because a lot of times when people, they'll say, well, hey, I'm not eating bad or I'm not taking any other medicines, but at the same time they smoke. And then maybe smoking makes your medicine get metabolized faster. There are certain medicines out there. And then you stop smoking, and then now all of a sudden the medicine got extremely strong. Today's generation, so many young people out there smoking weed. Well, weed, the CBD in it or THC, they often can have effect on drugs and maybe speed those drugs up or intensify them or basically lower them. So do an inventory also of what else is going on, because it might be something that you hadn't considered that you also need to tell your prescriber, like, hey, do you think that this thing could interfere with the medications that I'm taking? So just wanted to throw that in there.
A quick question with that. So like, what if you have, what if you actually are getting prescribed from a PCP? So you're not even getting prescribed from a psychiatrist or a psychiatric nurse practitioner, but you're getting prescribed this medication from a PCP, and you're also taking other medication. I think we stopped. So let me stop my live and then start it. Okay, cool. Let me make sure we're still going. But I still, it's like it stopped and then it came back. But what if they're prescribing you medications and you take other medications? Do you think PCPs think about, and I mean, this may be a hard question to answer, but do you think PCPs consider like this medication may be not effective because I'm prescribing other medications, or do they just add that on stuff? Because I know people who their PCP doesn't change their psychiatric medication, but they change the other ones all the time, and I don't think they consider how they class. So what would a person do in that situation?
Yeah. I would say all prescribers should be coordinating with the other prescribers that a person has. So as busy as we can get, is that always possible? No. But then you that are taking the medicine, I'd say I put some of it, the responsibility on you and myself as well. If I'm taking something from one doctor, I want to make sure that other doctor knows. So
right.
That I find out often that clients are taking medications that that I wasn't even aware of.
Gotcha.
Often they're taking antidepressants from their PCP and getting them from me, but say, not to just put names out there, you might not have heard it, but say trazodone. That's an antidepressant that often puts people to sleep. So it's prescribed for sleep. I might have someone on, let's say, escitalopram, Lexapro. So I'm treating depression with Lexapro, and their PCPs, like, my client can't sleep, and they throw trazodone on it. So now my client is at risk for serotonin syndrome because too much serotonin can be in their system. So it's very good to know what's being prescribed across the board. All people who have a stake in it need to know what's being prescribed.
So
I want to comment from a couple of things on the aspect on that. Me personally, and to each its own, first and foremost, I do not allow my PCP to prescribe me any type of mental health medication. I don't agree with it. I don't believe in it. Reason why I don't believe in it is because if you have a specialty, go to that specialist. I don't go to my PCP if I know I need to see my oncologist. No, I'm not going to do that. I'm going to go to my psychiatric doctor for the help directly, because my PCP is only going to want to see the surface. I want someone who needs to get to the underlying, I don't want to say the issues, because if that was the case, we wouldn't have the medication, but something to understand, why am I taking this? What is this going to do for me? Just telling me, oh, well, you're having a sleep issue, let me just throw this on you. For me, as a consumer, I don't believe in that. That will not happen to me. To also go back to the medications where, to the question asked, well, what if it's feeling kind of, I had medication where I didn't feel, when I found a medication, it didn't make me happy, but it didn't make me sad. I was just really straight borderline across. And for me, that almost made me more depressed, because I'm a social butterfly. I like being around people. I like making people laugh. And for me to look into the mirror and see that I can barely make myself smile, for me, that was my wake-up call. And it was time for me to look at other options. Because if I finally found a medication that worked and that was the end result, I didn't like that end result. So it's definitely, and going back to what Tori stated, you got to have patience. I know it can be uncomfortable, it can be scary, but you got to have patience. And it's really, really important that you find someone who's going to be patient with you, who's going to be understanding with you, because if not, that battle is just going to be useless.
A conflict. I like that too, of having a kind of a team behind you. A lot of people don't do this. I work on a lot of coordinated specialty care teams where I have in the past where there's a whole tribe of professionals behind one person. But the whole goal behind it is that like you shouldn't be on this journey by yourself. And we talked about this a little bit offline of having a therapist and having a person that's prescribing you medication and having a PCP. So you have a team of people behind you saying, hey, like, let's just say I did work at the same agency with Tori, or I did refer someone to him, and he reaches out to me and say, well, hey, Krystal, how's this client doing? Are they really doing work in therapy? Is this really a medication thing? What have they been talking, have they been explaining symptoms to you? Is this a new thing? Is this person even telling me and you the same thing? So having this team that can say, no, well, this person has been experiencing these side effects for a while, or just having that collaboration helps the clients. And I've seen so many people improve when the therapist and the prescriber had a great relationship, because they can make sure that their client was together on all fronts. Like, not only are you utilizing medication, but at the same time, you're also utilizing the skills that you're learning in therapy to learn how to manage your illness. And we run into this a lot. Well, I've run into this a lot, and I can't speak for you guys, with bipolar clients. It is a struggle because oftentimes when they feel good, what they want to do, they don't want to be on their medication, right? Because they like being up. I get a lot of stuff done. And so working with the prescriber and working with the consumer of teaching them skills and those to know their warning signs when they're about to crash or things like this, to me helps them manage their illness a lot better, because I do want to say medication and therapy is literally you learning how to deal with this thing that's happening in your life. And I tell people all the time, if you want to come off medication, if that's your goal, I would rather you come off medication with the tools to manage this than come off medication and you ain't got no skills and you just think you got to go out here and live your life and you don't even know your warning signs. So can both of you guys talk a little bit about that, of how, D'Angelo, for you, working with a therapist and a prescriber has helped you? And Tori, what is the importance of, from your point of view, of having a therapist and a prescriber if you need the prescriber?
Absolutely. Thank you, Tori. I would say for me, and my advice to anyone, Tori said something a little bit earlier as well that I think really we have to really talk about, and it's the accountability piece. Yes, in a perfect world, for me personally, yes, I have a psychologist, I have a psychiatrist, and I also have my PCP. Three greatest people, some of the three greatest people I've had an opportunity to meet. However, it's important for me, for my doctors to understand what's going on in my world. So if I have a vitamin D deficiency from my PCP, I'm going to make sure that I tell my psychiatrist that. So when we're discussing, okay, well, yeah, you've been complaining that you've been having low energy. Well, I've just discovered that my vitamin D level was low, which may contribute to the low energy level, which may also contribute to my depression. So it's really about accountability as well. It's really about making sure that you are talking to your doctors, because let's just be honest, in a perfect world, our clinicians may not have the time to sit down and call each individual person's clinician and say, hey, tell me a little bit about what Mr. Sears has been talking about. Let's just be honest, it's not going to happen. It's my life, it's my responsibility. So I'm going to take the responsibility and make sure that each of my doctors are well aware of what's going on, whether it's comfortable or uncomfortable.
Good.
I like that.
Yeah, and I mean, that's preaching right there. Because you have to take that responsibility. Because in a perfect world, it would be done. But we all know, no matter what your job is, whether you're a psychiatrist or a prescriber or therapist or whatever you do, work is work. So you don't always get a chance to do what you might need to do. So if you're the one that's taking the medication, let people know what's going on. The more we take accountability for ourselves, and I'm not trying to put anything on the client or the patient. I'm not doing that. I'm just simply saying, like, hey, we got to speak up because not saying something might kill us. Like, I might need to tell the doctor what's going on with me. And they say, well, you didn't tell me about that. I mean, often I have clients who didn't tell me all of their symptoms, and then I prescribe them something and they have an adverse effect. Well, I said, well, hey, I didn't know. And they said, well, yeah, this happens all the time. I said, well, you didn't say anything about that during our intake. So let people know what's going on with you, not just now, but what used to go on with you. And good to have loved ones close by. You know, mama can say this is what was going on, or your sister, or your significant other. Have people also on board, not just your PCPs and your therapists and all of that stuff, because the more people who are watching you and know what's going on in your life, the better we can keep this thing moving in the right direction. And Krystal, you asked about what do I think about a therapist as well as the prescriber. Studies already show that medicine is going to work better when people are taking medicine and going to therapy. So you're going to have better outcomes, basically. Mm-hmm. So I'm all for therapy. Like I said, I started out as a therapist. I only saw how African Americans were getting prescribed things based on, I would say, faulty information, stereotypical information. I didn't like that. So I wanted to try to come from an African American perspective and maybe try to correct some of those wrongs that I was seeing. But most definitely, my best, I would say my triumphs have been more when I have a therapist working alongside of me than just the medication, because medication does not fix everything. I would prefer for somebody to not even have medication. I prefer for somebody to learn coping skills. I would prefer for somebody to learn how to say no. I would learn for somebody to set some boundaries. And therapists are the ones that can help make those changes. Learning some breathing techniques. Like go to therapy and do those things. Let's maybe eat better. Maybe you can get somebody, a dietitian. Maybe you can go to a gym and get a trainer, exercise. All of those things have nothing to do with me. And I'd rather people do those things. I still want my job. I got to eat, but I want people to be healthy. And if you can be healthy without coming to see me, hey, I'm all for it. So yeah, therapy's needed.
Agree with that, and I want to piggyback off that because I often tell my clients when they come to me is I need you to work me out of a job. Like I needed to get to a space where you can come to me and say, Miss Krystal, I use this coping skill and I processed it this way and I did this and I set my boundaries and I got me a trainer and now I'm working with my dietitian or I'm working with my PCP. The goal is for us, yes, we want a job and yes, we want money. Is if we're in this field, we kind of got in this field because we love to help people. And again, like Tori said, we've seen these disparities out here that has increased this passion in us to help our community. So it's not about money for us. Whether you come or not, there's always going to be a client that comes behind you or after you. I mean, it's just the way the world works. So it's not necessarily about money for us. I also want to say this because this is a real issue and this is a Black platform that we're talking about Black issues on, is that again, I'm going to say this, all prescribers are not equal. And I've worked with some Caucasian prescribers that did not care about my consumer's life. And I don't know about you guys, but I'm pretty sure you all are advocates for mental health. And I'm always an advocate for my client. And I have seen some prescribers change some medication up for no reason, just because they thought it was a great idea. And I literally, this is a personal thing because it's one of those things that still bother me. My client was doing so well, y'all. Got a job, was getting promotions, bought a car. And again, when I work with patients who experience psychosis, that's a journey to get to that space. And once you're at that space, you're doing good, your medication is doing good. A new prescriber comes in and changes it for no reason. Mm-hmm. So for me, it felt like, is this your science project? It really was like, why are you changing this? What is the point? Kind of like what you said, Tori, is he having symptoms? Like, I just want to see if his diagnosis is real. Mm-hmm.
Oh yeah, I've actually had
takes that off your medication and it really affects the client's life. So that client life satisfaction went almost to zero because then he took him off this medication and didn't follow up accurately. and then struggle to say, well, I don't think he needs this or this and this and this. And this client's life was affected. So here we go. We have this white male psychiatrist. Not all white male psychiatrists are like this. So let me make this disclaimer. But it was a different experience when it was a Black psychiatrist, and then it turned into a white psychiatrist. Because when he made that change, he didn't really understand the context of how that change affects that young Black boy's life. So we want to talk about, again, that's what leads to mistrust of the system. Black people, we already are mistrusting of the healthcare system in general. So when we have experiences like that, it makes it harder for people to want to seek out help, whether it's a therapist or if it's for medication from a prescriber. It's a difficult situation to be in. So D'Angelo, what did you say?
Oh wow, yeah, you've taken me on a roller coaster with that one. Yeah, I mean, because it's so many dynamics when you look at mental health. First of all, the knowledge of it. For me personally, I was blessed with a mother who worked in the medical field, so I had someone to sit me down to say, well, son, if you don't understand something, you're paying that person. You have a right to ask 10 million questions to get an understanding. You don't let anyone rush you out of a room. If there's a word you don't understand, look it up. If there's things that you feel like you need, look it up. For instance, a lot of people don't know that insurance really does not pay a lot of money when it comes to mental health, behavioral health, I'm sorry. And so for that, I've had to incur a lot of cost out of pocket. A lot of people are unfortunate to incur those costs. So what do we do to do that? What are those plans, or what are those subsidies to help people to do things like that? That's one aspect of it. Another thing I want to touch on that you talked about as far as, no, I don't believe that all Caucasian clinicians or doctors or anything of that nature are all bad, but I've had my share as well. When I was going through a process of antidepressants, and it was a very bad journey. Nothing was working. I wanted to give up. I walked in my session with the psych nurse, and she looked me in my face, and I told her that the last medication didn't work. And she said, okay, so what do you want to do now? And when she said that to me, I wanted to literally give up. I stepped out and called my actual therapist and told her what this psych nurse just told me, because in that very moment, I wanted to give up my fight on mental health, because I felt like if my clinician didn't understand what needed to be done for me, how can I fight this battle?
Right.
Which leads to my next statement. It's okay to find another doctor. It's okay to find another clinician. It's like a relationship. If I'm not feeling you, if you're not meeting my needs, I'm going to leave you, and I'm going to find someone who's going to meet my needs. Because I did that, I was able to find a doctor who actually re-diagnosed me. I am now on an anti-anxiety medicine. By far one of the best. No, it is the best medication I have ever taken. My anxiety is definitely handled. I do have my bad days, because just like Krystal and Tori, you stated, it doesn't cure. It simply helps to get to a place where you can do other things to help, such as meditation, such as working out, such as utilizing your spirituality. With me building my journey, I utilize my friends. They help me through hard times. They help me through the good times. So it's definitely a journey, and it's definitely work to do. And you really have to be careful, especially as an African American, because let's just be honest, we are not awarded a lot of the same opportunities, resources, and knowledge that are given to our other counterparts, and that's how I feel about that.
That was some good stuff. There's a lot of good things you said in there, like a whole lot of good stuff you said in there. One of the things you said too that I loved was having that access to your therapist. And I want to say this, not every therapist is like that. So like, let's be clear, not every therapist will give you their number to call them. However, I happen to be one of those therapists, and this is not plugging it in, but again, my clients are investments to me. I don't just look at it as this is money. Like, I'm invested in their well-being. So I'm an advocate as well. And so to hear someone say, well, what else you want us to do? That made me feel a sense of empathy for you over the phone, over the Zoom. And I'm not even your therapist. I'm, your friend from way back when. But for me, that made me feel a sense of empathy because it was like someone was giving up on you because you was asking for something else. You was asking for alternatives. You were doing what you're supposed to do in healthcare, and someone was basically saying, "But we ain't got nothing for you." And
Exactly.
so that kind of made me feel some type of way because there are resources out here that people can utilize for mental health treatment. If you may qualify for safety net, and that's really if you go to a mental health agency, a community mental health agency, they have some programs, some payment plans. There's always things that you can use to work on your mental health if you don't have money. If you're working with a good prescriber, their prescriber will work with you. They'll give you payment plans. They'll give you samples. I done work with a
Yes.
prescriber that she done sampled some people out. I mean, she gave so many samples. It didn't make any sense. But it was because she knew that patient really needed it. She knew that patient didn't have the funds to pay for that amount of medication. Again, I work with psychosis. So you talking about $1,000 shot, right? So these injections ain't cheap. So to be able to say as a prescriber, well, I got some samples that I can help you out. Can you come up with a plan? Do you have some, I forgot what they call, but there's things that you can send in and people will kind of give you a discount on. There's a lot of options out here to where that you don't have to go broke paying for your mental health. And if it's a good prescriber, that's how you know you have a good prescriber. They'll go over there with you, or they'll send you to their receptionist who knows all of these things to get you set up, or their medical assistant to get you set up. But it's good to have a therapist that's kind of well versed in this. Again, this is why you want to have a team. I am by no means a prescriber, but working closely with a prescriber, I can tell you some of the things that she did to get some of her consumers by, and how we worked together to make people better, and people really got better. So yeah, there's a lot of different things in what D'Angelo said I think is really good. You do have a right to change providers. If you don't like that provider, you do not have to stay with those providers. You have the right to ask questions. So let me say this, you can ask about any medication that someone is prescribing you. You also can decline it. So you don't have to take it just because they offer it, just because they tell you to sign here. You don't have to sign there. I think Tori said something really good of having you some support people, whether it's a good friend, whether it's a good family member, whoever that's in the room with you, because you might not even be in a cognitive state really to know what you're signing or thinking, depending on your level of distress. So having a loved one there with you could be really, really helpful in this process that you're going in the process in your journey of medication, if that's where you're at. Tori, you got anything to say on that or speak on that?
Yeah, just you rehashing on that, having somebody with you. That's a good thing to do always, because you might not be in a state to explain. You think about it, and this doesn't mean whether you've had a diagnosis or not. We all have periods where we're depressed or we're sad about something. Well, when things are bad, daggone it, it feels like it's been forever. Like, just whoever is watching this on Facebook, when you had a bad day, something went wrong, and let that problem go on for a couple of days, it feels like you've been feeling that way for a year. When you're in the middle of something, that thing is overpowering. So you're not always able to even explain what's going on. But when you feel better, you almost can't even remember how bad you felt in the past. So it's always good to have that person that can say, hey, I remember it was pretty bad on you last month, or I remember you was down for like 2 weeks. Because when we're up, we're up. And when we're down, we're down. So it is always good to have somebody that can give you a little background of like, hey, you remember, you might find out that you've got some trends or some cyclic type stuff that you didn't even realize was going on in your life. Like, man, I do kind of get this way every time when it gets cold, or when the days are shorter. You might not even realize that, but a close friend or a family member might be able to bring that to your remembrance. Also, just having Krystal, you talk about like psychosis. There's so many diagnoses out there. When you talk about the African American community, like, nobody wants to be crazy. Nobody wants to have to be on meds. Bottom line is, we're all people. And I'd say you need a prescriber and a therapist who basically just sees you as an individual.
Yes.
And not as a project or some kind of anomaly, some kind of freak. I don't know what you want to call it. You fill in the blank, but seeing you as a person that has a problem right at this moment, or maybe some issues in life, because we all have those. When I get stressed, if my wife is watching this, she's know when I get stressed, man, my neck start hurting. Somebody might get stressed and they hear stuff. Somebody might get stressed and then they start like hyperventilating, which makes them basically have a panic attack. So your issue might not be so much that you're quote unquote crazy. You're just going through some things, a stressful time. So having people that see you as a person. So I would say when you're getting a prescriber and when you're getting a therapist, have providers that you can relate to, that see you as a human. And it's good when somebody can look like you, but hey, I'm not saying that just because somebody has the same skin complexion means that that's the savior and you're all right. No, it don't matter. Most of all, find somebody who really sees you as a person who's struggling right now, and then you all together can come up with a plan. So always have somebody like that can give some advice or basically give their 2 cents on, hey, this is how I think you've been doing, because a lot of times when we're in the midst of our issue, we can't see it. So I guess that's what I want to say.
Agree with that too. I like how you just kind of highlighted that you are not your diagnosis. You are not what I write on my paper. Sorry, I'm pretty sure you get this. A lot of people are always like, what are you writing down? It's like, I mean, I'm just trying to write down stuff I want to forget, like that I want to come back to. I'm not like trying to incriminate you or anything like that. So, but that's a question that's a real question that people always ask, like, what do you write down on me? But your diagnosis is not who you are. And I like that you said that, like, your diagnosis helps me get paid from insurance. Let's be clear, okay? Yeah. It helps me get my check from the insurance folks. And it also helps me know what I need to study to treat you better. That's all it does. It helps me know, like, okay, this type of therapy might benefit this person better, or these worksheets or this modality of treatment or whatever that I study can help this person get better. That's all your diagnosis is. You're not that.
Yeah. Also, when you talk about like your diagnosis, for people listening, I mean, everybody has different theories. People are probably looking at this a little bit more these days than they did in the past, but to me, it's a continuum. Mm-hmm. I mean, you might look like you got major depression now, but you live long enough or certain events come, it might look like it's bipolar at this time. But ultimately, and it doesn't mean some issues are biological, some things you've inherited, some things are chemical imbalances, but a lot, and since we're speaking to African Americans, especially in African Americans, a lot of our issues are trauma related.
Yes.
And we're treating major depression, we're treating bipolar, and truly it's trauma. So you might not actually get a diagnosis of PTSD, but ultimately that's what we're treating. We're treating trauma, we're treating adverse child events or adverse child experiences. So Krystal might want to talk about ACEs, but
ACEs. We talked a lot about this in our last series when we had just the introduction to this about how trauma still affects us, the trauma that we experience, but even the trauma in research that came from slavery, like we talked about, and a lot of people were like, "Whoa!" And I'm like, "Yeah, we're dealing with a lot of stuff that ain't even because of us, and even when we were kids." We're dealing with stuff that's not because of us. And if we want to talk about the Black community a lot more, how many of our parents just taught us how to cope with stuff? I love my mama, but she didn't sit down and was like, girl, deep breathe. She didn't say that. But now with my godson, we sit down and we'll meditate, or I give him things to identify his feelings. So when we're talking about in this Black community, our parents, our grandparents didn't necessarily know how to cope sometimes in healthy ways. And so
let me add this. So when we're looking at our community and we're looking at trauma, and not just current trauma, or childhood trauma, but like you were saying, even traumas that are from slavery or just in society today, and they, you look at it, call them microaggressions. Think about the guy that just got murdered
Mm-hmm.
And hey, as an African American male, how does that affect myself? How does that affect D'Angelo when we see that all he was doing was jogging? Now, I don't know what he did in the past, and it doesn't matter, but at that moment,
It
this
was
guy
jogging.
was jogging. And I'm not a jogger, but I've jogged before. So the day that I decided to jog, that could have happened to me.
Right.
So just the level of living while Black carries a level of stress. So
Mhm.
does that level of stress play a part on us emotionally and mentally, psychologically? Yes, it does. Does it play a part on us physically and for our health wise, metabolically? Yes, it does. So we can go into all of those things that already kind of bend or tilt African Americans for being susceptible to different types of mental health, different types of physical health problems as well. So we're don't feel like it's just for white
Right.
people. Like
Right.
therapy ain't for us or medicine ain't for us, because actually, man, we are all usually dealing with a lot more. We're dealing with what everybody else is dealing with and this extra
Excellent.
stuff. So yeah, mental health is real. Um, I know there's a stigma, and there always has been, and always will be in the African American community. Uh, yeah, we've got to fight with that spiritual thing. I've had people, African Americans, Caucasian white people as well, but they'll say, "My pastor told me that I don't need this." Now, not all pastors are like this. The world is changing, but
Mhm.
this is what I tell clients. I said, most people wearing glasses these days. You live long enough, you're gonna be wearing them. But I tell them, I said, "Does your pastor wear glasses?" And they'll say, "Yeah." I said, "Well, you tell your pastor to take his glasses off and stomp on them the next time he tells you that." I said, because our glasses, that's a prescription. I said, so if they can tell you you don't need your medical prescription, they don't need their visual prescription. It's all the same. And ain't no preacher getting ready to stomp on his glasses.
At
So
all.
yeah, exactly, at all. So just trying to make mental health understandable and not, like you said, we are not our diagnosis. Most people, so many of us had adverse child events growing up. It didn't mean that you were beat or neglected. Just the fact of your father might not have been in the home, or vice versa, or you saw some violence or low socioeconomic status. All of those are stressors, which usually increase the likelihood of African Americans dealing with depression or dealing with PTSD, or even increasing the likelihood of bipolar, increasing the likelihood of substance abuse,
Mhm.
which often is what we're using to treat these things. So nobody's taking medicine, but everybody's getting drunk. Nobody's taking
Everybody's smoking weed.
Yeah, everybody's smoking weed. So what I tell people is that at this point in time, weed ain't got a milligram on it. Weed has not been tested. So the blunt that you smoking on Monday often is not the blunt that you smoke on Wednesday. So you don't necessarily know what you're putting in your system. Is it exactly the same? And we can keep going on that, but I don't want to monopolize the time. So go ahead, Krystal. My
No,
bad.
I think that was all great, because I think that people should know kind of what you said is that oftentimes before you even walk in our doors, before you even step into his office, my office, before that problem, what we say the presenting problem, because when you come to us, stuff don't really hit the fan. So you don't just come to us, and then most people don't come to us like, oh, I'm good. You're lying. If you come to us, stuff don't really turn to if I'm seeing you're really distressed. So I think if you think about it like a cake, kind of like Tori was describing, you already had two layers before this life event hit. So don't feel like you're crazy because you need to go talk to someone, because you might be dealing with slavery, ACEs. You don't watch the video of this young man getting killed. And by the way, y'all, that is not helpful for us. It's just re-traumatize us over and over and over every time we watch those videos. So all of these things are happening in your head, to your brain, that you don't even realize is happening to your brain. And then go through a divorce or something happens at work, and then boom, you're exploding, and now you feel crazy because you think it's just that thing that just happened. So there's a lot of unworked through stuff that happens. So when you come to us, realize that, be a little easy on yourself, because you're probably dealing with battles that you don't even realize you're dealing with.
Absolutely.
So,
and Krystal, you're making you've made a really, really great point, as it relates to that. My journey, oftentimes when people say to me, why do you go to therapy? You don't need that. You grew up in church. Why don't you take it to the Lord? He'll make everything all right. My response to that, to people, is that, okay, well, do you tell a cancer patient, don't go see their oncologist, take it to the Lord and he'll make everything all right? No, you don't do that. Do you tell that person who has, heart issues not to see their cardiologist? No, because they need that. So why not have the same empathy? Why not have the same effort as it relates to mental health? Because believe it or not, Krystal, you stated that by the time people get to you guys, that they're not at a good place. I think also, as African Americans, let's change that. What's wrong with doing a checkup with yourself with a therapist? Just say, hey, I feel like everything's going well, and you will be surprised what you find out. For like myself, for instance, going back to family, my dad yelled a lot. So it wasn't until I got into therapy and I realized that I correlated the fact that when people yell at me, I get angry really fast. And it's just because I grew up in a house. My dad didn't necessarily yell at me. He just had a very strong voice, and everything he said was very loud. So you'll be surprised of the things you'll find within yourself just going to sit down and talk with someone. And then, yes, if you are someone who's on the other end of the spectrum and, you are in a bad place, and and I'll be exact, if you do feel suicidal, if you do feel as though life is, not going on, definitely go. It's worth it, because you will be surprised. Even with my own personal testament, I battled with depression starting in 2011. I lost my mother in 2016. My father became ill in 2017, and he passed away in 2018. So to anyone listening to this, yes, therapy saved my life. Yes, Jesus saved my life. You can have Jesus and therapy and know that your world will work just fine. So don't let anyone tell you anything differently about that. And to be very transparent, if you're at a church and you are in a ministry leadership and they tell you that you don't need that and all you need is God, please find you another church, because that is not a forward-thinking church. That is not progression that you need in your life, because it's about you. And if you don't take the stance that you need to do the things that you need to do, this battle will forever be difficult for you. There is no timestamp on mental health. There is no timestamp on medication. No, I don't like the fact that I have to take medication to calm my anxiety down. But I know in order for me to progress in life, to go to school, to go to work, to be a son, to be an uncle, to be a significant other, I have to have that medication. And so until I get to a point where I don't need it anymore, I'm going to do what I need to do to have a sustainable life. So sorry about that. I get a little
Hey, y'all gonna have to pass the collection plate for D'Angelo. That's good.
Exactly.
So,
Getting to some pastors. Go ahead.
Yeah, I want to add some basically what both of you all are saying. Krystal's talked about, it's real bad by the time you come to us as providers, and that's right. African Americans are 20% more likely to present with those severe mental health issues because they've let it build up. So it's not going on the front end. We're going to be more likely to show after, we've been baking that cake. It's 2 layers. And then you're coming in like it's the icing, but this thing been baking for a long time. One thing that I tell people, if you have something going on, just like D'Angelo said, it might start in 2011. You feel something. Yeah, we got a lot of things that we use. We might use friends and family and our spirituality, and those are good things to use. But when you need something else, nothing's wrong with just going to talk to somebody first before you even seek medication. I tell people when I have clients who just want medicine, because that does happen. I have clients who just want medicine, but they don't want to like do the work of therapy as well. And I'll tell them, I say, therapy is like getting your oil changed. I say, we get our oil change every 3,000 miles or something to that nature. I say, you don't just get your oil change when your car about to break down. So I was like, get an oil change. Yeah, you're doing pretty good right now. That's good. Get an oil change so you can continue to do
be good.
Yeah, it's not about waiting. That's one thing we'll wait till the wheels about to fall off.
Right.
Don't wait that long, people. African Americans, get some help. Talk to somebody. And if you're in the church, and hey, nothing's wrong with Christian counseling if it's a true Christian counseling, not someone that's just say trust in the Lord and it's going to be fine. Yeah, trust in the Lord and let's use these techniques. Like you said, medicine and Jesus saved your life.
Yeah.
Hey, I'm telling my clients who use faith, that's right. God made this medicine. We're gonna use this together. And if you're not a believer, hey, then that's fine. It's about you. So if you got a provider or a therapist and their focus is not you, then that's the wrong person.
Yes.
Absolutely.
So
okay, and I think those are really good points. I think that how Tori ended was well, like it is about you. It's not about us. When you come to us, it's not about us, my life, what I do, my faith. It's not about any of that. It's about how can we help you become the best version of you? How can we help you get you to where you want to be in your life? And with a lot of young people I work with, I don't know if this necessarily works for middle-aged people as well, but a lot of young people I work with, the goal is not to put you on meds. The goal is whatever goals that you have in life, how is this thing stopping that from happening, and how can we move past it? My goal is just to get you living your life in a way that you want to live your life. And if you think of it from their perspective of if I'm suffering in relationships, and with African Americans, honestly, that's when I see people the most. It's like their issue is affecting their relationships, or their issues are affecting their ability to make money. That's when I typically see them the most. When those two issues are being affected. But I agree with everybody else. Just check in with your therapist. You never know what you can get out of it. So our last question, even though my friend is like, keep going. No. My last question for you both is, if you could tell, and you've already gave the people like a wealth of knowledge, but if you could give them one more thing to say, if you were thinking about this, or someone has suggested this to you, or you had a bad experience with it, what would you say to them to encourage them to give it one more try? Or how do you, I had a good question before I get to that question. How do you find a good prescriber?
You said, how do you find, I'm sorry, say that again. How do you what?
So before I get the last question, how do you find a good provider?
Okay. Well, I would say all of the things that I said, that it needs to be about you. Of course, that person's need to be knowledgeable. If you have the ability to be that selective, you may not. It may just be where you were going and that was the prescriber. But when you find a provider, if their focus is not you, now that doesn't mean that they're going to do everything that you say. But if their focus is not your health, your best healthy you, if their focus is not that, in making you better tomorrow and the week after and into the future, then you've got the wrong provider. So you just do a litmus test. You just do say, okay, does this person really care about how I'm doing and where I'm trying to get to? Do they have a path? If you don't think that the answer to that is yes, then I think you should probably like look for a different provider if possible.
Okay. D'Angelo?
I would say For me, I was very blessed. My therapist that I started with in 2010 is still currently my therapist. But as it relates to psychiatry or prescriber, anything of that nature, I would say listen to yourself, listen to your gut, have patience, and understand that it's definitely a process. As I told you before we jumped on, I had a particular doctor where he swore by a particular medication, and I even knew people who had taken the medicine and it was great. And unfortunately, it treated me way worse. The doctor was so big on the medication that he would not take me off of it. So it was to the point I had to give an ultimatum of either I stay or you put me on another medication and I stay, or I leave. I did have to leave. It was very scary, but I just continued. You continue to fight this battle until you feel as though you have the right people in your corner, and don't give up, even when it seems as though things are really dim and really heavy, because it cannot last always.
Yes, that was good. D'Angelo, you good speaker. And my tips for you of finding a good prescriber, I would say number one thing, if you don't have a therapist, contact your insurance company if you have insurance. They have a provider listing, they have a provider book, and so they'll give you a list of people that's in your network that you can see. So if you don't know where to start there first. Two, if you have people that's in mental health, people that are already taking medication, people who are, I don't care if they're entry-level therapists, they're in school, they're interning, whatever. If you know someone that's in mental health, reach out to them and ask them if they know a prescriber, because 9 out of 10, they know someone who is a prescriber. And if they don't know someone that is a prescriber, I'm pretty sure they do know someone who knows someone. And so kind of like Tori said before, a lot of his work is word of mouth. People just say like, hey, this is a good prescriber. And hey, here's his number. Let me refer you to him. So ask the people around you that you know have some experience or some type of relationship when it comes to mental health. The third thing is just walk into a community mental health agency. There are a lot of agencies around. If you're in Nashville, we have places like MHC you can go to, which is Mental Health Co-op, who have a ton of programs. If you just really need some help, walk into there. If you're in Memphis, you have places like Alliance Healthcare Services, case management, and you have different places that you can go into it. If they don't take your insurance, they'll send you somewhere. They'll give you a referral somewhere. So there's always somewhere that you can start. They talked a lot about like you feeling it intuitively if this person is for you. But what I just talked about was the steps that you need to go to. Again, if you're watching this video or someone, you have shared it to someone and you don't know where to start in their process, feel free to message me and I'll get that information to you. I will not charge you for referral stuff. It's just my way of giving back. I don't think we all do. We just want to get help, whether it's with me, whether it's with Tori, whether it's just talking to D'Angelo, we don't care. We just want you to get help and we want you to take care of yourself. And that's what this series is all about. So I just want to thank Tori and D'Angelo for taking time of their Saturday night when the Erykah Badu and Jill Scott battle was happening on IG. And then they started late and it didn't make it no better for my show. But we're here. So I want to thank them for taking their time to come out and talk to you guys and share their knowledge and their experience about what they've been through. Stick with us next month. Our series is Breaking Family Curses. So we're going to bring some people on to talk about how they navigated breaking family curses, and probably have an MFT come on as well to talk about family dynamics things. So we always want real people on this show, and we always want professionals, because we don't want to just leave you with experience without knowledge, because knowledge is really powerful, and we want to give you the people that's actually in the field doing the work, making changes. So good night, y'all.
All right.